In a sign that the number of new weekly COVID-19 cases is falling, Singapore's weekly infection growth rate has dipped below 1 for 2 days in a row, the first time since the Health Ministry started reporting the figure. It was 0.96 on Wednesday, dropping to 0.93 yesterday. Finance Minister Lawrence Wong had said last month that if this rate falls below 1, people from the same household may be allowed to dine out in groups of up to 5. Another condition was that the hospital situation remains stable, especially in ICUs. For a closer look, Associate Professor Alex Cook, Vice Dean of Research at the Swee Hock School of Public Health, joins us now. Welcome back to the show, Professor. Professor, what are your thoughts on the weekly infection growth rate falling below 1 for 2 straight days? Is there a target or number, so to speak, of days in a row before we can safely say the situation is under control?
I would hesitate before we get too excited about the weekly case growth rate falling below 1. There are still quite large fluctuations in the number of cases that we see every day, and it was only last week when there was a spike of the 5,000 cases on a single day. So there's always a risk that what we're seeing is really just a short run of favorable numbers, which could be followed by a reversion. Even if we look past the day-to-day fluctuations, the case numbers, which is where this ratio comes from, these are diagnosed cases, they're not all infections. And the proportion of missed infections could be going up over time. Potentially, that would be biasing that ratio. So because of this, we would want to take the numbers of severe cases into account as well when we're trying to gauge whether the current wave is crested already. So for me, if by the middle of next week, if the weekly growth rate is still below 1 and the number of severe cases is starting to edge down, then I would personally be quietly confident that we have reached the peak of the first wave.
Professor, Singapore has been in the stabilization phase for about 1.5 months. During this period, you mentioned as well, we're seeing daily cases largely remaining constant. And we've talked about this as well, weekly growth rate dipping below 1, ICU occupancy rate stabilizing at about 70%. Are we starting to turn the corner?
So I believe that there are signs of optimism. So far, there's been about 130,000 cases in the general community. And if that's excluding the dorms. So in other words, 2.5% of the population have been diagnosed to be infected. Now, we don't know how many missed infections there are, but there might be perhaps finding 1 case out of every 4 infections. If so, that would mean about 10% of the population has been infected already, and that group will now be at very low risk of being reinfected again soon. 10% is also the proportion of the population that our models say should have been infected by the peak of the first wave, given the growth rate that we saw after we first started the stabilization phase. So with the weekly growth rate falling below 1, potentially, and the total number of cases now at a fairly high level, we're advancing through the population in terms of number of people who've been infected. We take those 2 pieces of evidence together, as imperfect as the evidence is, that does suggest that the first big wave might be peaking soon if it's not peaked already. However, that peak represents the level of herd immunity that can stop epidemic growth with the current restrictions in place. For example, the 2-person dining out rule. The level of immunity in the population to stop epidemic growth under relaxed safe management measures, that would need to be higher than that. So if the authorities can keep the current restrictions in place for a while longer, I would expect the current wave would peak and fall, maybe infecting about 20% of the population. But a second wave would probably start off again when we relax measures after that.
So on that, Professor, say Singapore eases restrictions at the end of the stabilization phase, whenever that is, and should daily case numbers go up again along with the growth rate, does that mean we go back to square one and have to tighten again?
Well, I think that we cannot rule out tightening measures again. We're seeing in some European countries, for example, that they've had to reintroduce tightening of measures when cases went up again. But overall, I think that there are reasons for optimism. For a start, after we peak, that means that the virus is not able to sustain itself at the current level of control that we've got just now. That's protection that we've now got in the bag. If the government stays true to form and they opt for a gradual relaxation of measures and not like a freedom day like the UK saw, for example, then Each time that they relax measures, that's going to lead to a growth in transmissibility and potentially then a growth in the number of cases. But as that happens, it's also going to lead to a growth in the level of immunity in the population. So one scenario then would be that we see a series of epidemic waves, each one of them with fewer restrictions and more immunity building up in the population until there's enough immunity in the population that we don't need any restrictions at all. Alternatively, we might see one longer wave if the government starts to relax measures soon after the first wave crests. As long as any second subsequent waves are not larger than the current one, then I think that we would have confidence that our healthcare system can cope with the number of severe cases that occur in each one of those waves. And if so, that means that we'd only need to tighten measures again in the worst case scenario in which those future waves start to go out of control because we reopen too much too soon. Given that the government has been really cautious in relaxing control throughout the pandemic so far, I'm actually quite optimistic that we can avoid having to tighten measures again in the future.
Thank you so much for your perspective, Professor. That was Associate Professor Alex Cook from the Swee Hock School of Public Health at NUS.